By the way, there is a gift, there is a reward waiting for everybody. This is a real contest. This is not anything like a fake one. So it is 100% genuine. Anybody who writes this letter and sends the answer on a clean paper, and if you don't commit to those very serious mistakes usually committed by most of the participants, and if you follow the Melons method completely, and if you score the highest, you will be, or you can be, the winner of this contest. The last day to submit this letter for this entry is 25th of June. So you have enough time. So just join this class, all the 9 a.m. classes, and you will learn all the Melons methods, and you can write this letter. And if you are so lucky, you will get a prize, and the prize equals the amount of booking an examination, OET exam, which is 34,000 rupees in Indian currency. And I will definitely give the gift to somebody this month. 100% sure, you can believe me. The only thing is, you will not be getting any correction of this letter before 25th of June. On the 25th or 26th or 27th, we will conduct a class in which this letter will be discussed in a live class. All right, I think we can start the class now. This is about the contest part. Okay, now we are moving to the letter, and today is the second day of the week. And you know what we do on the second day of the week? On Monday, we have, okay, so you can see this one. Okay, on Monday, we have the M and E. M and E stands for marking and elimination. Yesterday, we did the marking and elimination of these case notes. And today, we are going to do LO, that is launching and opening paragraph of the letter. Launching and opening paragraph of the letter. Tomorrow, we'll be doing the next level, that is a very important level, that is narration part. Narration and signing. Narration and signing. Narration means the second paragraph, third paragraph, fourth paragraph, fifth paragraph. That means the remaining paragraphs other than the opening paragraph. Narration is used with we deal with the narration by using diving and rising. I think you know that. 1 second, please. I'm sorry, I did not share the link with the main group, the paid group. I did not. They are waiting for that. Wait 1 second, please. All right, we are starting now. Okay, now no more discussion about the other things. We are directly going to the L and O today. Today we are dealing with L and O. So altogether our methods are like M, E, L, O, N, S. By following these methods, anybody can write any letter without any kind of problems at all. Doctors, pharmacists, anybody can write. So our Melons method is such a wonderful and a magical method. The only problem is, if you are a beginner, you won't be accepting it very fast. You will take some time to accept that one. So you'll think, what is this Melons? Oh, it is something like, I don't understand what it is. It's okay that I go back to my previous method of OET letter writing. So you may have a tendency to leave this class, or you may have a tendency to go for something else other than Melons. But Melons is so easy, because Melons, the first part is all about marking. We have done the marking yesterday. You remember? Yesterday we did the marking. Okay, and I can show you the marking here right now. And then we eliminated all the irrelevant details. That means in every case notes, there will be a lot of, or a little bit of irrelevant details, and you have to remove. So whatever you see here in red color, these are irrelevant details we just removed them all. Unnecessary details are to be removed from here. That is called elimination. Then today we are going to do the launching and opening paragraph, and then tomorrow narration and signing part of this letter will be done. Okay, now let's start with the launching and opening of this letter. We are going to start now. If you have any question before that, you can ask me. Otherwise, we are going to start the launching and opening paragraphs. We're going to start now.
Sir?
Yeah, tell me.
Recorded section.
Recording is going on. Yes, thank you.
Okay.
Yeah, usually I forget. Thank you for reminding me. But today I started recording at the very starting. Okay, so fine. Everybody, you got it. We are going to start the letter writing right now. So here, if you have prepared the paddock or the marking, so here, as per our method, the first thing is marking, and I have marked all of them. TP, RR, AA, D, 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 WK. Nobody will start writing any letter without marking these 12 or 13. I don't know how many are there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Yes, there are 13 elements here, and you have to see that. Yesterday, we had a very clear discussion about how to see all these things. P stands for patient's name and age. Then P2 stands for purpose, advice on low-fat dietary guidelines. R1 is all about the recipient's name, community information section. So here the recipient's name is, I think it is not there. And then, yes, then R2 is the request. Usually you will find some kind of request in the letter, but if you have noticed, you can see that there is no particular request in this one. So when there is no particular request in a letter, that will be equal to the purpose. That means purpose and request will be the same as purpose. Okay. Then we have got the A1 and A2, admission condition and admission date. You have to find it out. What was the admission condition of this patient? Okay, then admission date of the patient is also important one, admission date. And then we need discharge condition of the patient. There are around 12
admission
different
date
kinds.
2nd September.
Once again.
No, so just I'm saying the admission.
Yeah, okay. Admission date is 2nd September. Yeah, fine. So then we have it. So please, everybody, please look at the screen. If the screen is very small for you, please zoom in and you will be able to see it very clearly. And also, please don't keep the phone in the portrait mode. Please keep it in the landscape mode. Okay, so that means tilt the phone. Then we have got the discharge condition, recuperating after or from, you have to decide. Then discharge date, ready for discharge or transfer. Usually discharge date can be today, tomorrow, something. Sometimes it can be ready for discharge or transfer. You know that this is not a transfer letter, so there is no doubt about this. So it is a discharge letter. And then D3 is all about what? D1, D2, D3. D3 means, what is D3? Date of writing.
Date of writing.
Yeah, date of writing. Some people think that date of writing and the date of discharge will be the same. Not necessary. These are the reasons why we lose mark in the OET examination. Many people are not aware of these things. Then we have got the D4. This is whether the patient is diagnosed. You know that if a patient is diagnosed, then the patient will also receive treatment. You usually don't send the patient back home just after diagnosing, saying that Mr. Peter, your diagnosis is over, you can go home. We never do that. Okay, once the diagnosis is done, we will be treating. If you are treating, then we will discharge the patient only if the patient is recuperating. Otherwise, we will only be doing what? If the patient is diagnosed and treated by you, and there is no improvement in the patient's case, tell me, will you transfer? Yeah, you will be
transfer to other facility.
Doing the, yeah. So otherwise, we'll be discharging. So whenever you hear the word discharge, so discharge means it is basically not to a doctor, but to a nurse, basically, or to a physiotherapist. And if it is a discharge, it also means that the patient is going home. It can be to his own home, her own home, or maybe to an old age home or any other facility from where the patient was earlier transferred to your facility. Then we have got the last one, D5, that is direction. In this case, ABA is a direction. ABA means the patient is coming from one place, coming to your place, and going back to the same place. Home to hospital, and hospital to home.
Home.
ABA. And we know that in most of the cases, ABA are known cases, but not always necessary. Okay, because suppose a patient is coming from an old age home. Okay, a patient is coming from an old age home to your facility, and you are sending the patient back to the same old age home. Is it a known case or a not known case?
Non-case.
It's also non-case.
It is a known case, okay, but this one is different one. So please never judge ABA as a known case all the time. It can be unknown case also. So we cannot say it is a known case just because it is an ABA. Okay, so ABA. So there is another one, ABC. A patient is coming from one facility, maybe from the home or from another facility, and coming to your facility. Your facility is B. B is yours. Always B will be your facility where you are working. It can be a hospital, it can be a clinic, it can be anything. Okay, the patient is coming from the patient's home to your facility, and after the diagnosis and treatment, you decide to send the patient to another facility. That is C, A, B, C. All the three are different one. And then there is the last one, that is ABB. A patient is coming from patient's own home, and you are receiving the patient at the emergency department, and then from the emergency department you are sending the patient to another department in the same hospital, that is known as ABB. So basically, in the last 1 year, I think those who are with me studying for the last 3 or 4 or 5 or more than 5 months, you know, we have never seen any other direction other than A, B, C, ABA, and ABB. Generally, we see only these three kinds of directions. So all these things will make your OET letter writing so easy. All right. And by the way, I would like to tell you, I'm not going to refer any name. I'm not going to see, because it is not at all good thing that one OET trainer is finding fault with another OET trainer. But it is, you know, I really felt so sorry, so bad. So since I'm not going to mention the name of that trainer, it is one of the biggest OET trainers, and I'm not attacking anybody there again. So there was, I watched some of the YouTube sessions of that, and they were discussing some of the OET errors very confidently, but see, 5 out of 10 of them were wrong. And this is what I want. I don't want to tell anything more about that. You don't have to even ask me who they are. I'm not, because I'm in the same field, so I'm not supposed to give any kind of indications like that. So, okay, their way of teaching is good one, I know, but the mistakes they are pointing out are so, I don't know what to say. They should not have uploaded such a video like that. So please, whenever you deal with your writing, I think you should be very confident about that. So in my case, I can tell you something. In writing, you will never fail if you follow all my instructions, because a lot of clashes are there, a lot of clashes. What I teach is completely being clashed by the same trainer. And I think that that same trainer is trying to focus on me. Maybe, I don't know, because some of the examples he is discussing is the same example which I discussed. And he's saying that these are all wrong, but he's not targeting me personally. Okay, anyway, that's a good one. That's a decent one. But this is so bad. If you follow all kinds of free and such, YouTube trainers, be careful about that. They may be very famous, but everything that is famous is not always good. Remember that. Okay, anyway, that's the rest is up to you. And please don't feel that I am targeting anybody, nothing like that. I'm just targeting you because you are my only concern. You have to pass, you have to go abroad, that's all. Okay. Then we have to move on to the next area. Okay, so writer is here. Writer is Lee Wong, registered nurse. Since we usually don't write the name of the writer, we don't have to mention this one. If you want to mention Lee Wong, okay, no problem. So, but there's a problem. Are you sure you are Miss or Mr.? In the case notes, it says you are Lee Wong. Lee Wong. Since it doesn't say whether it is a Mr. or Miss, what are you going to write? The only thing is you can leave this one. Lee Wong, registered nurse, because a nurse can be a female or a male. Second thing, in letters, we generally don't write the center's name. So you can simply avoid this. Registered nurse will be enough. And it is a not known case. So we have prepared the marking element here. All the marking is clear here. Now we are going to start writing the letter. So yesterday we completed the marking and elimination. Now we are going to start the letter by taking only what is required from this case notes. Let me take it from here. I'm going to copy this one. Now have a look at this one, everybody. In this area, you can look at this one, please. This is a content we are going to write. This is a content I am going to paste it here. See, now see what I'm going to remove. Everything I'm going to remove. See, we know this one. We know all these things. And we have to remove everything that is in the red area. Removing this and removing this and removing this. Yes. And so now the case note has become very small now, very small. And there are so many other things you can remove later on. Now, it is time for us to start with the first paragraph and the launching. L and O, we are starting here. Okay, if anybody here who is watching my class for the first time, you have to also watch the remaining part of this one, which are available in our group. You can watch it. Okay, you won't be in any trouble by watching our videos. I won't put you in any trouble. Okay, so we are going to start with the L and O today. What is L? L stands for launching. Yes, launching of the letter and then opening of the letter. These are the two things we are going to discuss today. Launching. For launching, we have a method known as DADS. And for opening, we have got a method known as PRPPD. Okay, PRPPD. There are 4 kinds of PRPPD. I will discuss that later on. Now, DADS. What is DADS? Date, address, dear sir, madam, whatever you want. Yeah. And then subject. And in OET, you know what is the subject of OET letters? That is always a referral. Yeah, RE. Okay, this is it. Very simply, you can write. And then some of you may be asking, why do we need to follow these kinds of methods rather than why can't I write it directly? You can write it directly, but the problem is many people will forget at least one of them. Some of them will forget the date. Some of them will forget the dear. Some of them may forget the RE part. You will have a high tendency of forgetting one of these elements. And if you miss any single element, your mark is lost. So we have to start with this one. So date means which date? Which date are we going to write? Which date are we going
Date of writing.
The date of writing is to be
Writing.
Yeah, fine. So date of writing will be here. Date of writing. D3 will be the one. This will be the date of writing. Okay. So this is, then where is the address here? Where is the address?
In writing task, sir. Writing task.
Okay. So but from Pradok, this one plus the address. This one plus the address. And then dear who? Who are we writing to? Yes, again, here we can find it out. And in the reference area, there are 2 things, the patient's name and the age. The patient's name will be here and the patient's age is here. All the details for launching is available in this area alone. So this is why I told you, you have to prepare the Pradok first. Pradok means this one. This one is Pradok. You have to prepare the Pradok first. Once you have prepared the Pradok, the letter writing is going to be so easy and you will not miss anything. That's it. So that's very clear to you. So you can write the letters starting point here. I'm just writing it for you. So the first one, we are writing on 9th September. Okay, please, let's complete this one. 9th September
2009.
2009. Okay, then what is the address? The community information section. Information section. Yeah, of course. What is the second line?
Gregory Terrace.
Yeah, there is something Grigory Terrace. Okay,
Yes.
I'll copy it here. I'll copy and paste it here. Grigory Terrace, and make sure that everything is written in, like all should start with a, okay, fine, capital letter. Grigory Terrace, Brisbane. Okay, that's it. Grigory Terrace, Brisbane. Fine, we can write only this much is required here. Then, dear what? Dear, do we know the recipient's name?
Excuse me, sir.
No,
What
sir, we
about
don't know.
Once
the
again.
system of that foundation?
Okay, there is something more about that one, right? Yeah. Yeah, Heart Foundation. Yeah, there is one more word missing here. The community information section.
Of the Heart Foundation.
Yeah, so we generally don't have to write off here. Heart Foundation, the community information section, Heart Foundation, Grigory Terrace, Brisbane. This will be the complete one. No full stop or comma at the end of any of these lines. Remember that. Okay, and after this, we have to go to the dear area. Who are we writing to? Do we have the name here?
No, sir.
So, and
No.
can we write dear
Dear
sir?
Sarah, madam.
Yeah, since we don't know whether this recipient is going to be a man or a woman or male or female, we have to write this one, or madam. And there is a comma required here. This one will require you to write a comma here. And then we have to move on to the next one, that is RE. Then whom are we referring here? What is the name of the patient? Mr. Bill, Oriel.
Oriel.
Oriel, and of course, a semicolon is required. And what is his age? Age is not mentioned. So you can write the date of birth. So
12th
DOB,
January.
yeah, DOB, then a colon, 12th January.
1956.
Yeah, 1956. Some people are highly confused about this one. Some people are spending unnecessary time and they're taking unnecessary burden on their mind. They're just asking me sometimes, is it a colon or a semicolon? See, these are not very important things. You shouldn't waste your time on unnecessary things here. Even if you don't have this one, even DOB, this dot is also fine, no problem. You can write a colon is the best one. Sometimes you can even write this way, it is also fine. So what we have to worry about is not these simple details, but more important details are there. Okay, we will be discussing those things later on. So here we have got the RE. Mr. Bill Oriel, date of birth, this one, this one, this one. Is there anything missing here in the first part, in the launching area? Is it all okay? The launching part is okay? Okay, if
Sir,
you are...
I have a doubt, sir. Miss or Mr. After that, no need to full stop. If you are giving full stop, is it
No,
wrong?
it's okay, no problem. Like you're talking about this one.
Yes, Mr. After Miss or Mr.
These
Stop.
days, people have stopped giving a full stop after this one. Now, the trend
Okay.
is this one. Without dot is the trend these days. Mr., Mrs., and all those things. The trend is without a dot. Okay, if that is very clear to you, we are moving to the next area. So we are dealing with the launching is done, and then now we are going to do the we are going to do the opening paragraph of this letter. Opening paragraph is a very important part of every letter. So please come to the second column of this one. Please come to the second column. We are going to do with PRPPD. What is PRPPD? So you have to write the patient's name. What is the patient's name? Mr. Bill Oriel.
Bill Oriel.
Oriel. Okay, Oriel. Now requires PR. P stands for patient. Patient's name is this one. And R stands for simply this word requires. Requires. Okay. What does he require? What does he require? Yeah, advice on.
Advice on low-fat dietary guidelines.
Advice on low fat
Dietary guidelines.
dietary guidelines. See, OET letter writing is so easy, and people are simply unnecessarily worrying about OET letter writing. Aditi, there is some noise from your side. Please mute. Okay. Advice on low-fat dietary guidelines, and there is a full stop. And then what is next one? PRP
He
is
is
then.
recuperating.
What is the present condition of the patient? That will be the main content of the second sentence of the first paragraph. Yeah, he is. Yeah.
Recuperating.
He is recuperating after
Coronary artery
coronary artery
bypass grafts.
bypass graft. Yes, and then
And he is ready for discharge.
and is ready for
Discharge.
discharge. Okay, see, look at this one. Patient is Mr. Bill Oriel. Then Mr. Bill Oriel requires, second part is requires. What does he require? Yes, basically advice on low-fat dietary guidelines. Then next one, he is recuperating after coronary artery bypass graft and is being, and is ready for discharge. See, I think we have completed the first paragraph so easily using the PRPPD model. Mr. Bill Oriel, P for patient, requires R. So please stop writing, I am writing this letter to refer. I am writing very old method, very old method. Please don't stick to such very much old method. You have to be, nurses and doctors should be some, they should be proactive people. They should be, modern kind of people. Don't stick to very old styles, and you can even lose your score for that. If OET is looking at the various behavioral aspect of the nurses who are writing the OET examination, you can even fail here. If you are somebody who is writing, I am writing this letter, I am writing this letter to refer. See how useless this is. Okay, Suganya, please mute your mic. See, I am writing. Everybody knows that you are writing. And everybody knows that you are writing, not you are not drawing this letter, you are not painting this letter. You are writing. Yes, you know that. And of course, it is a letter. It is not a book. It's not a novel. It is not a journal. It's a letter. Yes, we know that. And this is to refer. Yes, you have already said that you are referring, because in the very beginning you told it is referring. See, referring is here. So why are you repeating all these things? This is a letter, we know. And you are writing, you are not singing. And this, everybody knows it. So why are we writing this old standard one? Simply stop it all and simply start. Mr. Bill Oriel, yes, requires what? Advice on what? Low-fat dietary guidelines. Okay, then he's recuperating from what? Not from, but from after a coronary artery bypass graft. And then what about his discharge? Oh, he's ready for discharge. Letter perfectly written. The first paragraph is written perfectly. Otherwise, you will be simply doing something old method and nothing will come from your brain. But this method will help you to take everything from your brain rather than from the YouTube videos. Somebody told, so I am writing. But when you follow the PRPPD model, it's not like somebody taught and I am writing. No, I am writing because I know this. This is known as the genuine OET letter writing. I don't know how many of you can understand what I'm trying to say. So here, this is it. Mr. Bill Oriel requires advice on low-fat dietary guidelines. He's recuperating after. So some of you may be simply just wondering why after. Every time we hear the word from, right? Did anybody think that way? Did anybody think that way? Like why there is an after here instead of from? So remember, next time you write, if it is a procedure, like a surgery, something, if it is in connection with a surgery or a procedure, you have to say he is recuperating after a procedure. But if it is a disease condition, then from disease condition. This is important one. He is recuperating from pneumonia. Okay, but he is recuperating after angioplasty. See, that's it. Okay, so I hope it is clear to you. Maybe some of you will require more time. Yes, tell me.
Sir, I have small doubts, and
Yeah.
he's ready for discharge, no? So, Already patient is returning to home, right? In the task they have given returning to home. So
Yeah.
can we
write what? Tell me. Mahalakshmi, I can not hear you.
write ready? He's discharged, sir. In the opening paragraph, we are writing he's ready for discharge. No, instead of that, he is discharged today. Is it right?
No. Because if you go to the case notes, look at the case notes here. Where is it?
Returning to home, they have mentioned.
Yeah, returning. Yeah, please have a look at this one. In the third column, please come to the third column. Returning home to Woodwind. Okay, returning. It is only saying returning, but when? Is it a when mentioned?
Yes, sir.
Returning doesn't mean that he is returning today. That means he is ready for discharge is the best one. We can never say he is returning today. There is no mention that he is returning. That means whenever you see ing form, see, have a look at this one, please, everybody. Have a look at this one. Whenever you see an ing form, my sister is getting married. What is it? What does it mean? My sister is getting married. Does it mean that she's getting married now? Today?
No, sir.
No.
She's going to get married.
Yeah.
Yes.
So the best example I can say, I am writing my third OET exam. Does it mean that it is today? No. This question that you asked, Mahalakshmi, the question that you asked me is a very important question for everybody in this class. So ing form does not mean this is happening today. I am writing my third OET exam. When? Yeah, I don't know. Anyway, I'm planning to write. Okay, that can be, that means I am going to write. It can be I am going to write. So I am writing is equal to I am going to write. So he is returning also means he is going to return. So sometimes ing forms mean something differently. Okay, I hope you got that clearly. Okay, fine.
And in the sentence, I have one more doubt, sir.
Yeah, please.
Is discharged? It's not a it's a related question, sir. I have a doubt. Is discharged? He is discharged. That means, can we take it as the present tense or past tense? The discharged is past tense, past verb.
I tell you.
Yes, is this a verb present?
He
So
is,
how can we take the sentence?
I tell you, he is being discharged. Okay, he is being discharged. He is discharged. He is ready for discharge. These are some of the very familiar lines that he is being discharged means the process is going on. Process is on. That means the nurses and doctors and everybody is busy with his discharge. That means one nurse is writing the discharge letter, another nurse is preparing his bill and other things, and so the discharge process is going on. He is being discharged. That means mostly that is today. He is being discharged today or any time from now, but the patient is still in the hospital. Patient is still in the hospital. He is discharged. The meaning of he is discharged means it is more specific than the first one. He is being discharged. If this one takes 1 day's time, okay, and then he is discharged means it is almost now. That means usually the best thing I can say in 1 hour. Nobody can give you the exact number here, but of course, to be more specific for your convenience, I am giving you this kind of guidelines. He is ready for discharge means it can be within a day. Within a day, it can be even after a day. What that means, 1 day plus. That is, he is ready for discharge. It can be today, it can be tomorrow, it can even be day after tomorrow. Okay, then there is another one. He has been transferred. Okay, he has been transferred means in this case the patient is in the ambulance. He has been transferred. He is being transferred. Being transferred means he's being transferred means the process is going on. The process is going on. maybe the patient is being pushed into the ambulance, maybe, or the wheelchair is getting ready. So the process is going on. Process on. That is the meaning of he is being transferred. Okay. And some people write he is being. Please, if anybody is writing he is being transferred. This is some very informative information which I saw in the same video which I told you in the beginning of the class. Okay, I told you that there were some errors. There were so many errors, but this one is a very good one, very well explained in that class. He has been transferred. So we can never write he is being transferred. So being will come only with the H family. He has been. He has been. If you want is, if you are particular to is, then with is we write being. Okay, being is the word we have to write. He is being transferred. Okay, he is being transferred. Don't write being plus is. Is being is completely wrong, and has being is also completely wrong. Has plus being is also completely wrong. Please don't write any of these things unnecessarily. Okay. So okay. So these are some of the things you can use it. He is being transferred. Then he is being transferred. He will be transferred. He'll be transferred. He is ready for transfer. He is ready for transfer. The meaning of this is the last one. He is ready for transfer means from your facility, everything is okay. But now you are waiting for their approval. See, you have a patient and you are going to send the patient, or you're going to transfer the patient from your facility to another facility, but this is not an emergency transfer, so you are waiting for their permission. So he is ready for transfer. That means the patient is still in the hospital and you are waiting for their permission. Okay, but at the same time, he is being transferred means it is for emergency department. It is for emergency department. For every emergency transfer, you can write he is being transferred, or even he has been transferred is also fine in the emergency cases. So everything is different slightly. Okay, I think it's all clear to you. Okay, Mercy, are you talking to me? No. Okay, fine. Okay, so if anybody wants to talk to me, you can talk to me anytime. Okay, so once again, let me conclude
Yes,
this.
sir, I was talking to you.
Yeah, but your voice was not reaching here. Please tell me, please repeat.
Sir, he's being transferred. Do we have to mention time frame with that?
He's being transferred. No, usually we don't write. He's being transferred means, see, the meaning of being means being is equal to what? Now. One of the meanings of being indicates at present. So we don't have to write the time frame there. It's not important. He's being transferred is enough. Okay. All right. Okay. So once again, finally, Mr. Bill Oriel requires advice on low-fat dietary guidelines. Full stop. He is recuperating after coronary artery bypass graft and is ready for discharge. And after we don't have to write anything, like any article is not required before any kind of disease conditions. Okay, there are only 3 disease conditions where we have to write article or an. Does anybody know that?
Fever, flu,
yeah,
and one more I forgot, sir.
Even I also forgot that. Okay, fever and flu. I think it is okay. And
OET, 100 OET errors it was there.
Okay. I think that is influenza, because these all belong to the same thing. No. Basically, flu and fever will be in that area. Okay, fine. Thank you that you are going through the OET 100 errors, but sadly, many people do not go through that letter because it is completely free. Okay, that is my mistake. Okay, I should not have committed that mistake. Mr. Bill Oriel requires. Okay, fine. So we have completed the PRPPDC. The opening sentence is very well written. And do you know one thing? In most of the cases, no OET assessor is going to read more than this much. This is the most important part of it. Do you think that OET assessors are going to read your letter completely, especially if the handwriting is so dirty? No way. Nobody's going to read it. They will read the first part, the launching part and the opening part. And if the handwriting was good, and if there is not even a single mistake, no cutting, no correction, no overwriting, everything clean, clear, your score is almost decided. They will be very happy to give you 350 something, and then they will go to the last part of it. Where is the last part? Yours faithfully or yours sincerely. If that is also clear, you have almost passed. But that doesn't always happen, which means we have to write the whole letter. So don't think that they are not going to read the second paragraph, third paragraph, fourth paragraph, but generally a good impression will be created in their mind by looking at the the launching area and the opening area. So we have completed the opening area. I told you there are 4 different kinds of PRPPD. And this is PRPPD. And there is another one. Suppose you are writing this letter to a known person. So we have to use another one, which is known as UPRPPD. UPRPPD. So how is that? This is to update the health status of, yes, then remaining will be the same. Mr. Bill Oriel, who requires advice, the remaining thing will be the same thing. So if you are writing a letter to somebody who knows the patient already, that means in the known cases, just add this line. This is to update the health status of, that's all. And then after the patient's name, just write one who. But never use the who in the normal cases. So if it is an update kind of a letter, update letter, so U stands for update. This is to update the health status of Mr. Bill Oriel, who requires, see, in the cases of UPRPPD letters, we always require a who after this one. A who is required. Don't forget that, okay? Now, there is another one, that is TPRPPD. TPRPPD. And what does T stand for? T stands for thank you. Thank you. Okay? These thank you letters are written, or TPRPPD letters are written when you have already talked. You have already talked to the recipient over the phone, over the telephone. So everything comes together. Telephone, talked, and thank you. All the three words start with a T. So that is called TPRPPD. So how will you write that one? So just remove this one. Thank you for accepting Mr. Bill Oriel, who requires, see, same thing. So this is very important for you. So whenever you write the first paragraph or the opening paragraph of an OET letter, the first thing that you have to decide is it a PRPPD letter? Is it a TPRPPD letter? Is it a UPRPPD letter? Whatever it is, you have to think first. Then only you will be able to write it properly. So this is a simple PRPPD letter. So if you know that it is a known case, start with UPRPPD. If you know that there was already a communication between the recipient and the writer, then you can write thank you for accepting. Okay, especially like an appointment has been scheduled. Okay, in that case, an appointment has already been scheduled for this patient. See, first you contacted, see, first Apsara is a writer. Apsara is a writer. Benny is a recipient. And the patient is Christy. To transfer Christy to Benny's facility, Apsara first called her. Benny, I have a patient called Christy. She needs urgent assessment and this one. Is it okay that we can transfer her? Okay. Is it an emergency case? Benny will ask. It's okay. It's a kind of a semi-emergency case. You can give an appointment for her if it is possible. Okay. Benny will say, fine, do one thing. Today, it's a packed day. So you can send her by tomorrow morning. Is it okay? Okay. Then, anyway, the communication has been established between Apsara and Benny, 2 nurses. regarding the transfer of a patient who is not in a critical stage. So Benny has given the consent or permission to Apsara for the transfer of the patient. So before transferring the patient, it is Apsara's duty to write a letter of transfer. So what will she write? Thank you, Miss Benny. See, we don't have to mention the name there. Thank you for accepting Miss Christie. Okay, so remaining, you can follow the same PRPPD method. So these are the three kinds of letters, opening. And then there's the last one, that is PPRPPD. The last one is PPRPPD. This will be very beneficial for many of you. What is that one? When there are two patients, see, when there are two patients, or when the patient is a baby and the accompanying person is the mother or a father, parent. Okay, so this can be, you can call it parent, patient and parent. Okay, you can call it whatever, or patient and partner. Okay, these are the two cases. Either the baby is being brought by the mother or father, usually mothers, and one partner is brought by the other partner. So this one is PPRPPD. Okay, so in this case, what you can write, you have to always write. Suppose there is a mother who is bringing the baby. The problem is breastfeeding. So of course, the 1 week old baby does not need any advice from the nurse. Baby, you have to do this way, that way, this way. We don't. Okay, so basically, we cannot write the patient's name here. So we have to write, suppose the mother's name is Miss Apsara. Miss Apsara. Okay, mother of baby Rayan. Okay, then just follow the same thing. Requires, continue the same way. PPRPPD, same thing. Miss Apsara, mother of baby Rayan, requires advice and guidelines on breastfeeding, whatever you want to write. See, and the remaining thing will be the same thing. No change will be there. So PPRPPD, that's a beautiful introduction for this one. I hope it is all clear to you, all of you.
Sir, one last question.
No, you can ask any number of questions. Yeah.
Sorry. So if the question say the patient is transferred to emergency department, if the question itself says that, so does it come under TRPPD?
No, that is, there are two kinds of transfer. One is emergency transfer. The other one is non-emergency transfer. Okay, so in your question, did you ask me the patient is being transported to the emergency department?
Yes, sir. Yes, it's an emergency case, urgent attention.
Okay, in that case, we have to write, 1 second. We have to write the normal PRPPD because you have not contacted the emergency department at all, right?
Yes, sir.
So I will convert this one into that. So this is a typical example for PRPPD. Mr. Bill Oriel requires urgent assessment and management. Okay, management. Then he is recuperating. Of course, if somebody is recuperating, we will never send him to the emergency. He has symptoms suggestive of, usually symptoms suggestive of, yeah, the only thing which I know is this one, myocardial infarction. Okay, and is being transferred. This is the way we write. Or infarction and is, we can never write he is ready for this. Ready is a different one. Whenever you write the word he is ready for transfer, this means you are waiting for their permission. He is ready for transfer, but if you say yes, we will transfer. So that is not an emergency case. In all the emergency cases, it will be and is being transferred or and has been transferred. These are the two words that we write. Is being transferred means the transfer process is going on or the patient is on the way. But has been transferred means the patient is already on the way. That is more clear. Mr. Bill Oriel requires urgent assessment and management. He has symptoms suggestive of myocardial infarction and has been transferred. This is how we write emergency cases. Is it clear to you?
Yes, sir. Got it. Thank you.
Okay, so please follow our PRPPD method. Okay, PRPPD method. So the only problem is you won't be able to see our advertisements on the billboards on the in the cities because we are a small company. Okay, small one. Okay, so you won't be able to see our advertisements on Google, on YouTube. So we don't have that much time and money to do this kind of advertisement. But one thing is 100% sure. These methods are 100% reliable and you can write any letter using these methods. But the only thing is that you have to forget your previous methods and you have to come to us and completely trust us completely. This is what I want to tell you. So this is the end of the launching and opening part of this one. So tomorrow we are going to start the narration part, which is not very easy, but if you follow our methods, diving and rising method, you'll be able to write this letter. So tomorrow's main target will be to write this letter completely. Okay, so that's it. If you have any other question, you can ask me now. Okay.
So tomorrow we have no class. You said evening there is a class, the test, right?
Oh, right. Tomorrow is a test day.
Wednesday, right?
Yeah,
Yes.
Wednesday is a test day for the existing members. So it will be a free day for them. They will have to attend the 7 p.m. session only. And to be successful in the 7 p.m. session, you have to go to the 100 error book. The book is already available on our website. You can simply open it on your mobile phone and you can simply read it. You have learned a lot. I know you have learned a lot. So tomorrow's 100 questions will include reading, listening, writing, speaking, and even grammar. So you have to score. All the existing members have to, I repeat, all the existing members have to score a minimum of 80 out of 100 to go to the A group. Otherwise, they will have to stay in the B group for 1 more month. Okay, and those who are planning to join the June batch, they have to score a minimum of 40 out of 100 in tomorrow's 100 marks test. It's a very important one. So to make sure that they will pass, they have to study well. They can go to our YouTube channel and they can study well. So that's what I have to tell you. So tomorrow will be a free day for the existing members only. But for the others, we'll be having continuous classes from the morning. Okay, so don't forget that. Any other question, please? All right, you're tired of my continuous blabbering. Okay, so see you then by 12 p.m. The next class starts by 10:30. Bye-bye. See you.
Thank you, sir.
All right.
Thank you, sir.
All right.